Hi guys, thank you so much for joining me. Welcome to my YouTube channel. If you are new here, my name is Ore. I am a pharmacist based out in Ontario, Canada, and I use my platform to share inspiring pharmacy related stories. I talk all things relocation, whether that's from any nation into Canada or into the UK or out of Canada, wherever that relocation may be. And I also share my different tips and tricks on how to be a successful pharmacist or how to be successful in your healthcare field. I also like to bring people onto my channel to share their stories, to help inspire us and to get us all to a place where we are forced to move out of our comfort zone. Today, I have an amazing industrial pharmacist with me here. Her name is Mariam Ajala. I worked with Mariam actually a few years back when we were trainee pharmacists. So it's so amazing to have her on the channel today. Mariam is a previous community pharmacist who transitioned into industrial pharmacy. She's here today to share her journey, how she transitioned, how to pivot, and how to basically take yourself from what you have known all your life or what you are, trained or educated to do into a place that seems completely different. I hope this inspires you to move out of your comfort zone, and I'm really looking forward to this conversation. So stay tuned and make sure you like and subscribe if you like this content. Hi, Mariam. Thank you so much for joining me today. I'm so excited to have you here and to just delve into this conversation, and also maybe to just talk about some of the old things that we both know have experienced in pharmacy. So do you want to share a little bit about yourself for my audience?
Of course. Thank you so much for having me. My name is Mariam Ajala. I'm a pharmacist. I went to the University of Manchester and got my MPharm degree there. Did my pre-registration with Lloyd's Pharmacy in London. I actually worked with Ore as a pre-reg for the same big company. And then after that, I went to work for MIMS, who are prescribing reference. And then I was lucky enough to cover one of my friend's maternity leaves and joined industry in medical information. After about 2 years in medical information and training as a final signatory, I jumped into a medical advisor secondment, and then I did another final signatory position. And then I've had multiple stints at multiple companies working as a final signatory. So I work predominantly in medical affairs as a final signatory for pharmaceutical companies. And that's me in a nutshell.
Amazing. So there's so many, I guess, nice words and titles that you mentioned there that I wanted us to kind of chat about, because I feel like as pharmacists, not everybody really knows what these job titles are or what they look like. So you first mentioned obviously leaving community pharmacy. Yeah, we worked together at Lloyd's Pharmacy, which was really nice. I actually enjoyed.
Yeah, it was. I enjoyed it as well. It was a great time. Yeah.
And then you went on, I think you worked for a little bit in community, and then you moved into, you started your industry journey. So how did you do that? How did you pivot and transition? Because I know that's something that a lot of pharmacists struggle with, just if they're working in hospital or retail for some years and then wanting to go into industry. So how did you kind of get yourself in that space?
Yeah, I want to put out a disclaimer before I say this. It is more difficult now, definitely. I moved in about 7-8 years ago now, and I think there was much less competition when I moved in, because I see people who are probably more qualified than I was when I moved in now who are still having some difficulty. So I'll just start by saying that. But at the time, I was actually, while I was a pre-reg in the year we worked together, I met a locum pharmacist who came into the pharmacy shop. And she was covering a Saturday, and I asked her what she did Monday to Friday, and she told me she worked in industry, and she kind of just worked in community on weekends just to keep up her community pharmacy skills. And we kept in touch, we made friends, and a couple of years later she actually messaged me and said she was going on maternity leave and they were looking for cover. Would I be interested in covering? So this must have been maybe 2 years later, but I think it just shows the power of keeping in touch with people and organic networking. I'm not a huge fan of inviting 100 pharmacists into a room and saying, clicking their fingers and being like, okay, network. I think it's really important that these relationships develop organically, because you can't force people to like each other. You can't force people to click. So me and that pharmacist, we clicked. We're still friends today. She covered my maternity leave last year as well. So that was how I got into industry. And then from there, I think with industry, once you're in the door, you kind of just can move around, and there's a limited number of pharmaceutical companies, so you can kind of just move between them and find roles that suit you.
Yeah, that's so interesting. I really love, one of the things that I share a lot on my channel, and if you follow me on Instagram, LinkedIn, I'm always talking about networking and the importance of that. And I think what you mentioned about organic networking is also so important. So I think there are opportunities by going to events or just meeting people randomly, even like connecting with people online. It could just be kind of like make a connection on LinkedIn, and you just never know where that will go. So did you have to, I guess, adjust your resume in any way to kind of like suit the position? Did you have to get any training? How did you prepare yourself to go into that position?
So when I actually left Lloyd's Community Pharmacy, I was working for a prescribing reference called MIMS. And the reason I chose to move into MIMS is because they wrote about drugs. So MIMS is a prescribing reference. So if a new drug came out, they would publish in the journal kind of, this is what the drug is called, this is the dose, this is the cost of the NHS, and a few other details. But then they also wrote articles about drugs, and I knew that what that would help me do is like hone in and better my writing skills, my medical writing skills, but it would also teach me about a broader variety of drugs. The unfortunate thing about community pharmacy is you're day in, day out, you're usually seeing the same kind of drugs. You're not really going to deal with intensive cancer treatment in community pharmacy because they get those treatments from hospital. You're not really going to deal with HIV treatments every day because they get those treatments at specialist centers. So I knew writing for a prescribing reference would enable me to look more practically at drugs that I'd only learned about theoretically at university. So working at MIMS as an editor in that sense actually helped me, even though it wasn't directly linked. And this is what I tell people when they're trying to move into industry. It doesn't actually have to be an industry role. It might be a training role. It might be another medical writing role. It might be a medical communications role. But all of these skills are skills that you don't necessarily get as a hospital or a community pharmacist, but that they can still be helpful. With that being said, I do know people that have moved straight from community straight into industry with nothing in between. And I think it's just about realizing like these skills are transferable. As a pharmacist, you give people information about their medicines every single day, if you're doing your job correctly anyway. So those kind of skills, you have them anyway. You might not do them in the same way as somebody in industry, but you do have those skills. So I think it's really important that people can adjust the skills they already have to suit the roles that they're looking to go into.
Yeah, this is so important. I love how every single conversation I have with a guest on my channel always ties in with something that I've spoken with someone else about, or something I've shared about. Recently, one of my previous videos, I talked about, coming to, a country like Canada, or if it's someone coming to the UK or whatever it may be, you can look at what you've done in your previous role, in your previous country, your previous experience, and basically tailor it to what they're looking for. And I think sometimes it's something that we miss out as pharmacists. Like we think that our job is just like, just one direction, and we don't look at the other things and the skills that we actually, have from those roles, and how it can be tailored into a different position. So that's so key. So I'm really, really happy that you were able to mention that. The next thing I want to talk about or ask about is, what is a final signatory? What does that role look like? How important are these people in, I guess, our pharmaceutical world? And how did you get into that after you kind of left your first few positions?
So a final signatory is, in the UK, they have to be a doctor or a pharmacist, and their role is to ensure that everything the pharmaceutical company does, whether that's producing materials or adverts or hosting events for healthcare professionals, everything that pharmaceutical company does is compliant. Now, compliance should be everybody's priority. So whether it's your marketing or your sales, we hope that everybody's working towards a compliance culture. But as a final signatory, you have to ensure that, in the UK anyway, that pharmaceutical company is abiding to the ABPI code of practice. And what that does, there have been quite a few films on Netflix.
I was going to say,
about the pharmaceutical industry and how it's run rogue. And one of the films, I can't remember what the name is right now, but one of the films, they kept saying, we need a compliance department. And I kept screaming, that's what we do. Compliance is important, because if somebody in a company wants to run rogue, or you want to pay a doctor £10 million to inadvertently prescribe your drug to patients that don't need it, compliance stops that. You hope that lots of people before compliance stops that, but as a final signatory, it's your job to literally sign off, put your stamp on, put your signature on this material, and say this is either compliant or this is not compliant. And if it's not compliant, you go back to the drawing board with the team who developed it and make sure you can get something compliant out. Now, final signatories aren't the heroes. It's not just on their shoulders, and it's not their sole responsibility to ensure compliance. But because that is more of our focus, it means when a team does develop something and we're called in, we can kind of say, hey, look, here's a red flag, or, you know, you're heading in the right direction. And ultimately, because we know our name and our reputation is on the line, we make sure that those items, we can, you know, with clean hands say, we believe we've done the right thing here. Because ultimately, yes, pharmaceutical companies produce drugs, but those drugs were invented to help patients, and we need to make sure that those drugs do help patients. So we work in the UK according to the ABPI code. In Ireland, it's the EFA code, but there are codes, rules and regulations, and of course UK law that we're bound by, that we just have to make sure that companies work within that framework.
Now, this is interesting, and I have two questions, and I want to go into a bit of a rabbit hole here. So my first question is, obviously, as a licensed pharmacist, does your license with the General Pharmacy Council cover you? Because I know, obviously, GPHC is focused on patient care, which is part of what you're doing as well. But, you know, obviously, because you have to abide by these pharmaceutical codes and rules, do you have to have a separate license or a separate kind of like governing body that makes sure that you're doing your thing as a pharmacist or the final signatory? Or is that also covered by the GPHC?
So you have to be registered with the GPHC if you're a pharmacist who is going to become a final signatory. So that's kind of a basic requirement. Then on top of that, every company has to send the MHRA and the PMCPA. So the PMCPA is the body that does the ABPI code. Both them and the MHRA have a list of all the pharmacists for each company that work as final signatories. Now, I've never heard of this, and I don't know if this happens, but I assume that if, you know, things are going wrong all the time and it's the same signatory signing things off, that, you know, a conversation will need to be had. But they do have a register for these pharmacists. So it's not like you can just sign things off and, you know, do things as you like in whatever way you like. There are governing bodies, and the MHRA, I would say, is a bit more serious than the PMCPA, because the PMCPA is a self-governing body, like kind of within the industry. The MHRA, you're talking government, you're talking law, so you really need to be serious with that, and kind of, you know, no one wants to get in trouble there. So yes, the answer to that is yes.
Yeah, absolutely. And for people who may be watching who are Canadian based or the US based, MHRA would basically be equivalent of our Health Canada or FDA if you're in the States. So they kind of basically are the people who regulate drugs and they approve drugs and all that kind of thing, and other things as well. So thank you so much for sharing on that and just, you know, giving us a bit of insight into what that looks like. So the rabbit hole I want to go into is, let's take it back to 2020, COVID, when COVID happened. One of the things that kind of came out more, and I know people had these feelings and these ideas even before COVID happened, is you know, pharmacists and pharmaceutical companies are just trying to make money off us, and, you know, they want us to be sick so that, you know, they can basically make money and all this stuff. And I'm always that person who's trying to share, like, actually, no, like, pharmacists want you to be okay. Like, obviously our job is, you know, it's without you guys being sick, we won't have much of a job. But at the same time, we do want to see our patients get better. So knowing that there are final signatories who don't just allow pharma companies to put out whatever they want and do whatever they want, and, you know, they don't allow things like bribes and things like that, what would your response be to people who are kind of in that headspace? Like, you know, this pharmaceutical company is just releasing things like the COVID vaccine, for example, to make money off us and just to make us even more sick so that they can make more money. Like, what's your response to those kind of like communities?
So I think there are two camps to address here. I think there's the fellow healthcare professionals who literally, I had conversations when I left community and told people I was joining industry. They were like, you're selling your soul. And I was like, that's not the case. So to other healthcare professionals, I just want to say to them, like, we've seen the films that have been made. We know the stories of what happens when people who haven't made an oath and who haven't promised to take care of their patients and who just want to make money. We've seen what happens when those things happen. We are almost there we are there in order to stop that. So people saying, yes, you sold your soul and all that, you know, you could say with other healthcare professionals, you could say that to a pharmacist who's dispensing the medicine. If you weren't there dispensing it, somebody else would be there dispensing it. People are going to need medications, and as people get well and as people live longer, if, you know, it's not something while people are young, unfortunately, as people get older, it might just be a matter of time until it's something else with the aging population that we do have. So to healthcare professionals, I say I'm doing the job and making sure that healthcare professionals are represented, and the care of patients is our priority. So that's kind of my rebuttal to that. But to patients, I say to them as well, like, we don't strictly stand in one camp as healthcare professionals or people that work in industry. We ourselves are patients in multiple ways. We have family members that are patients. If that was the case, the father or the mother of somebody who had cancer would never either get cancer or would never be treated by one of the cancer drugs. In my day-to-day work, I work with people whose children take the medicines that we work with, whose parents, whose grandparents, whose spouses use the medicines that we work with. So I think people need to stop seeing us as purely pharmaceutical industry or big pharma workers, and as individuals, yes, who do work for pharma, but we're also patients. We have people that we love dearly that are patients as well, and we want to make sure that pharma gets the best that it can be, so that, you know, if we could make all illnesses redundant, I'm sure most of us would, but I think it's important that we need to understand, if we look at today now, I think Final Signatories, we're doing the very best we can in order to get out the drugs to patients that need it, but make sure it's being done in a compliant way. So yeah, we're humans too, and I think people need to remember that as well.
Absolutely, yeah. And I think it's a big reminder, obviously, that, you know, there are people, individuals in different industries, not just in pharmacy or, you know, medicine, who may have like ulterior motives. But at the end of the day, this is why we have people like yourself, the gatekeepers, you know, the same with the pharmacist in a community pharmacy. You know, a physician may have his or her own intentions for a medication for a patient, but you have these gatekeepers who are there to make sure that these things are being done properly, appropriately, and safely, you know. So, you know, we really appreciate the work that you're doing, because you guys are doing you're doing the work that, you know, saves us having to make sure, you know, the meds are, you know, appropriate or whatever. Obviously, we still have to do the clinical piece, but it's always good to have as many gatekeepers as possible to make sure the meds are going out safely to patients. So going to the question that I'm sure lots of pharmacists or even doctors, whoever it is, may wanting to go into industry, maybe asking or thinking, is it financially encouraging? Is it financially, does it make sense financially? Should I leave my, you know, conventional pharmacist position or my conventional medical doctor position and go into pharma? Does it make sense for me financially, for my family? What are your thoughts on the financial rewards of this kind of industry?